We represent continuity of care to the patient, the go-to person to try and make sense of their healthcare experience. That means we need to have a really broad understanding of what's going on with the patient. But what we tend to do is spend a lot of time trying to access that information so that we can translate for our patients.
Because we're still using individual systems that are currently not talking to each other, what we seem to be doing is a lot of duplicating data, having to remember all these logins. Every time a password expires, you have to then remember a new one.
So the greatest frustrations for me are losing patients' notes, and as a result, working in surgery, having patients cancelled on the day of surgery.
We spend hours on end. Where has the notes gone to? That is time wasted, taken away from nurses looking after patients. Some of the handwriting is so difficult. There can be misinterpretation of what is written down.
A test can go into the ether, and it isn't very clear at what point it was ordered, at what point it was delivered, at what point we're about to get the results back.
Having access to a comprehensive patient record from wherever they may have been cared for within UCLH will make a huge difference.
It's going to add a whole different dimension to the story and help patients get treated in the right way. We'll also be able to add flags to patients. So if a patient's got a cancer diagnosis, got an allergy, got learning disabilities, that could be flagged up immediately.
Everyone will be communicating in one system. With the alerts and the reminders that will be coming with Epic, I don't then have to start chasing up our doctors or pharmacists. Once that reminder pings through to them, hopefully they know that it's their turn to do their part for the patient.
Having a system whereby communication is improved at every single level will undoubtedly improve patient safety. And it won't be without its challenges in the beginning while we understand the system, but I think long term, ultimately, it will improve patient safety.
Today there are over 600 care plans that a nurse could choose from our intranet to use to deliver care for their patients, and they simply don't have the time to trawl through all that information. So I'm really excited that we've used some of our nursing colleagues to design a suite of care plans that we've built into the system, and a simple yet robust holistic nursing needs assessment so that all the patients' needs are assessed, but in a very rapid, quick-fire way, with the assessment expanding and contracting to meet the patient's needs, and that will trigger the care plans that the nurse needs.
The electronic health record system will be automatically calculate somebody's news score, and the same with fluid balances. So it gives a really clever clinical picture.
For me as a matron, being able to see all of the systems and all of the patients and knowing that they are receiving their drugs at the right time, that their pain medication's been given, will be fantastic.
In my role as a ward sister, I do a lot of investigations. If something goes wrong, I need to request for the medical notes. With Epic, I have access to the notes when I need them in real time.
A lot of the ward sisters' time is spent manually collecting data to input into their exemplar ward data. So one of the benefits of EHRS is that it will automate that audit cycle.
And we'll be able to allocate patients to nurses and midwives based on their acuity. It'll be a much more systematic way of allocating workload, and that means it'll be fairer.